Occupational health. The occupational health has 4 different parts. The first one, we'll talk about introduction. In this part, we will introduce what is occupational hygiene, what is occupational health, and what is occupational hazards. The second part, we will talk about toxicants and poisoning. The toxicants including heavy metal, for example, lead. Then third one, we will talk about pneumoconiasis. In this part, we will introduce different types of pneumoconiasis and the different causes of the pneumoconiasis and the treatment for the patient. And the last part, we will introduce the emergency rescue in industry. Let's move to the first one, introduction. In the introduction place, 4 different things we will introduce. The first one is what is occupational hygiene. The second one is what is occupational health. And then the third one is occupational hazard. The last one is classification of workplace health hazards. Let's move to the first question. What is occupational hygiene? Occupational hygiene, or we can call it industry hygiene. In the US, it's industry hygiene. Occupational hygiene is the anticipation, recognition, evaluation, control, and prevention of hazards from work that may result in injury, illness, or affect the well-being of workers. This identification came from IOHA. So in this sentence, there are 2 different words, important words we have to know. The first one is the hazards. Just look at this circle. So we know the hazards. We can find different hazards in our daily life. For example, the polluted water, the polluted air. In the polluted air, you can find the particles which may go into human body. But in the occupational hygiene, when we talk about the hazards, we focus, or maybe we can say we only focus on the occupational place. So these hazards will only introduced in the occupational place. You can only find this kind of hazards from occupational places, or the occupational hazards which hurt the workers, result in different illness. So the second important word is workers. When we talk about health, preventive medicine, or hygiene, the subject is human being. But for the occupational hygiene or the occupational health, they only focus on the workers. So the illness and the injury or something not well-being for the workers only related to the occupational affected results. So 2 important words. The first one is hazards. So we only focus on occupational hazards, not the daily life hazards. The second one is workers. The occupational hygiene or occupational health focus on the workers. What happened to the worker's health? What happened to the worker's body after the work? So that is 2 different important words in the occupational hygiene. And the hazards are typically divided into 5 different categories. The first one is biological, the second one is chemical, physical, ergonomic, and psychosocial. These 5 different things for the hazards in the occupational place. Majority of the hazards should be biological, chemical, and physical one, especially the chemical hazards, which we can find is the most of the hazards in the occupational place. Occupational hygiene including 4 different stages. The first one is anticipation. This involves identifying potential hazards in the workplace before they are introduced. For example, before we went to a factory to do some measurement, we didn't know what kind of the occupational hazards you can find in this factory. So that is before they are introduced. So after they introduced, you will recognize the potential hazards in the factory. So recognition, this involves identifying the potential hazard that a chemical, physical, or biological agent or an adverse economic situation poses to health. So after they introduced the potential hazards, we will recognize which one is the most dangerous hazards in this factory. It may the chemical agent or physical agent or the biological agent. After recognition, if we suppose that is a chemical agent, we have to do some measurement. That's evaluation. Then you will see evaluation. This often involves measurement of personal exposure of workers to the hazard in the workplace, particularly at the relevant interface between the environment and the body. Look at this picture, you will see two different types of measurement. The first one you can hand on the workers. The second one is you can put on the floor, but the height should be as high as the workers' breathing place, like this breathing place, as high as the workers' breathing place. So two different type of the measurement can help you to measurement the personal exposure of a worker to the hazard in the workplace. So breathing zone is important for the measurement. And if you want to test is anything will hurt the workers' hearing, so the hearing zone also important. Then we can assessment of the data in terms of recommended occupational exposure limits. So it's OELS to find the occupational exposure limits. Then compare to the occupational exposure limits to see in this factory, for example, maybe the chemical agent may be higher than the occupational exposure limits, or it just follow the criteria exist. So we have to do the evaluation. And after the evaluation, if in this factory, the occupational hazards, for example, chemical agents, increased and higher than the limits, we have to do the last step is control. So we have to control of the chemical, physical, or biological agent or the adverse economic situation by procedurally in engineering or other means where the evaluation identifies that this is necessary. So we have to control different types of the occupational hazards, then can protect the workers from the occupational related injury or occupational related disease. And it also can keep the workplace clean and do not harmful for the workers. So we have 4 different steps for occupational hygiene. The first one is anticipation, then do the recognition, and do the evaluation and the control. So the second question is, what is occupational health? After we know the occupational hygiene, we want to know what is occupational health. In 1950, the Joint International Labour Organization Committee said occupational health is the highest degree of physical, mental, and social well-being of workers in all occupations. So in this sentence, we can see, just like the preventive medicine focuses on the physical, mental, and social well-being of human being. But for the occupational health, the subject changed to the workers. So we hope all the workers in all occupations has physical, mental, and social well-being. And after years, we give the occupational health more meaningful things. So occupational health can be defined as the maintenance of the individual worker's state of well-being and freedom from occupationally related disease or injury. So we hope individual workers can stay well of physical, mental, and social well-being. We also want to lay far from the occupationally related disease or injury. So occupational health more think about the occupationally related disease, not the normal disease. This disease or injury should be occupationally related. For example, we have different lung disease. For a normal person, after the daily exposure to the polluted air, they may have the lung disease. But this lung disease is not because of occupational hazard. That is because of the polluted air you can find in our daily life. So that would not be the occupationally related disease. All the disease or injury we want to talk about in occupational health should be related to the occupationally. So you can see this picture is the unhealthy lungs. You can find black spots inside. That's the small particles. The second picture, you will see this patient has a waste drop. If the waste drop because of the occupational hazards, that is an occupationally related disease. Why we always focus on the occupational things? Because the occupational disease in the different countries, you may get the payment from the government. If this disease is not related to occupational hazards, you won't get any payment from the government. So that is why when we talk about occupational disease, we focus this disease caused by the occupational hazards. So then occupational health, we will see in the work activity, if the work is exposed to different occupational hazards, they may get occupational related disease. For the exposure, the occupational hygiene is very important. We know 4 different steps of occupational hygiene to do the exposure occupational hazards: measurement, recognition, evaluation, and control. And for the disease, we can use occupational medicine to help the patient. So put them together, that will be occupational health. So occupational health, including the occupational hygiene. That is why we talk about occupational hygiene first. Then let's move to the third question is, what is occupational hazards? You can also watch the video we put on the prep. It's about occupational hazards. So what is occupational hazards? This is a question is, which one is not belong to the occupational hazards? The first one is solar radiation. The second one is poor posture and pesticides and pollen. And you can guess which one is not belong to the occupational hazards. They may say, suppose it is the first one, solar radiation. Is that true? Let's move to the occupational hazards. We have 2 different things to introduced. That first one is what is occupational hazards, and the second one is what is productive toxicants.